Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then diagnosis of anaplastic carcinoma of thyroid. So if we see the diagnosis of anaplastic carcinoma of thyroid, diagnosis is mainly done by FNAC. And if you do an FNAC, you will see that there is giant cells are seen. You will see giant cells which are multinucleated giant cells are seen in anaplastic carcinoma of thyroid and on FNAC. So mainly, sometimes in most of the cases, sometimes we even need an incisional biopsy may also be needed to confirm the diagnosis. Then treatment. In the treatment of anaplastic carcinoma of thyroid, the best treatment is obviously it is a cancer, so it is better to do a thyroidectomy is done in most of the cases. But the problem is this is a highly deteriorating tumor. Because it is a lot more deteriorating tumor, it will lead to very small improvement in survival. So combined, so along with this thyroidectomy, we also prefer doing the combined radiotherapy and chemotherapy is also done in the patients in the advanced setting. And both these three approaches can these three using thyroidectomy, combined radiation and chemotherapy can prolong the life of the patient. But because there is airway obstruction is common in these patients, because this anaplastic carcinoma mostly it compresses the surrounding structures. When it compresses the trachea, it can result in airway obstruction. So whenever it compresses the trachea and causing airway obstruction, then we should do tracheostomy in order to prevent the airway obstruction. Then prognosis. Prognosis of anaplastic carcinoma of thyroid. So in the prognosis, this anaplastic carcinoma of thyroid is the most common aggressive tumors among all the thyroid malignancies are the anaplastic carcinoma of thyroid. Because it is most aggressive tumor, it deteriorates very rapidly, and thus the patient will have less than 6 months of survival immediately after detection.
thank you and thank you for watching.